It's time for our health report, and joining us now is Africa 54 health correspondent Lenore Mudu to tell us about radiology and domestic violence. Lenore?
Thank you, Esther. Actually, we will talk about measles today. The western U.S. state of Washington is battling a measles outbreak that has affected more than 40 people, the majority of them children. The disease was declared eliminated in the U.S. in 2000, but has since made a comeback that is tied to imported cases and the rise of the anti-vaccine movement. The majority of those infected are children, many of whom have not been immunized against the disease, officials say. Health officials have warned that people infected with the disease had visited areas such as schools and churches. They added the outbreak could still be in its infancy as the incubation period of the virus averages 14 days. Those infected can spread measles to others 4 days before and 4 days after the rash appears. The highly contagious disease can cause severe diarrhea, pneumonia, and vision loss, and ultimately can be fatal.
It's incredibly contagious. You can be in a room, if you're susceptible, you can be in a room that somebody with measles left 2 hours earlier and still get the disease. If a person with measles meets a population that's unvaccinated, about 90% of folks are going to get the disease.
The impact of this current outbreak has been pretty significant in our area. Washington and Oregon tend to be somewhat of a region where we immunize less than other parts of the country, and we're seeing the effects of that. Certain populations have been exposed to the measles, and we've had a significant issue the last few weeks. And unfortunately, I hope I'm wrong, but I think the cases are going to get more frequent and spread throughout the country from this epicenter.
According to the U.S. Centers for Disease Control and Prevention, at least 10 states have reported cases of measles in 2019, including California, New York, and Texas. The outbreak has renewed debate over the so-called anti-vaccination movement, in which fears about potential side effects of vaccines have led a small minority of parents to refuse to allow their children to be inoculated. Meanwhile, in Europe, more children in the World Health Organization's European region are being vaccinated against measles than ever before. But progress has been uneven within countries, leaving increasing groups of susceptible individuals unprotected and resulting in a record number of people affected by the virus in 2018. According to the WHO's measles data for the year 2018 released Thursday, monthly country reports from January to December 2018 shows that over 82,000 people in 47 countries contracted measles in the European region, causing the death of 72 children and adults. The total number of people infected with the virus in 2018 was the highest this decade. The European Vaccine Action Plan 2015-2020 lays out a strategy endorsed by all 53 member states to eliminate both measles and rubella. At least 95% of every population needs to be immune through 2 doses of vaccination or prior exposure to the virus to ensure community protection for everyone, including babies too young to be vaccinated and others who cannot be immunized due to existing diseases and medical conditions. Now we turn to West Africa, where Nigeria is stepping up its measures to control the recurrence of Lassa fever. Nigeria has begun beefing up its measures to control a Lassa fever outbreak. Health officials say the disease has already claimed the lives of 42 people since January. In 2018, Nigeria recorded the highest reported cases in the history of the disease. This year, the situation is even more severe. Chikwe Ehekwezu is CEO of the Nigeria National Center for Disease Control.
So in the first 4 weeks of this year, we've had more cases of Lassa fever detected. We had 70 cases in the last 2 weeks, consecutively, more cases than during the same period last year. So we're now focusing on the response, focusing on supporting the states that have a higher burden, make sure they're well prepared to prevent, detect, and respond to Lassa in our country.
Observers say Lassa fever is a significant challenge to Nigeria's healthcare system. The disease has become an annual problem for the nation's health officials. The World Health Organization is helping Nigeria contain the outbreak by collaborating with third-party health institutions. In the city of Jos, in Plateau State, 8 deaths have been reported and over 40 confirmed cases have been recorded.
We've galvanized efforts in responding to any outbreak of Lassa fever. We have a very strong team here of specialists in infectious disease who have managed Lassa over the years.
The Plateau State government has started a sensitization and awareness program for health workers and community leaders to prevent the spread. Kaneng Pam participated in the program.
I didn't know that if one has a swollen face, it's also one of the signs of a possible Lassa fever case.
The Nigerian CDC has developed national guidelines for infection, prevention, control and disease case management to reinforce the measures put in place to contain Lassa fever.
And that's our health report for today. To stay in touch, find me on Twitter @LenorMudu. Esther, back to you.